So I'm joined now by Tom Gransbury.
Hi guys.
Welcome, Tom.
Thank you,
Who is going to be part of our facilitator, co-presenter role in this discussion. And as a junior doctor who's a few years my junior and in that early career with a passion for education, I thought it'd be great to get Tom's thoughts on some of the questions that we've raised during this presentation. So what are you doing right now, Tom?
So I'm currently a PGI2 general trainee, so I guess relieving at the moment, jumping between all sorts of teams, which is a nice way to see a bit of a full spectrum of the hospital, and then looking to maybe do some work at the Women's and Kids next year if I can.
Great. And let's talk about your interest in education and how you've managed to fit that into your student and now early career doctor experience. Yeah,
so I mean, a lot of it came from just informal teaching. I come from family teachers and quite liked the idea of just getting involved with some teaching. I think David Lamb was one person in the rural school that I got involved with, and he was happy for me to join in and do a couple of sort of teaching sessions together as a fifth year. I found often with some, initially med tutes and peer-to-peer and those kind of programs are really good ways to, I guess, get some experience with general education. Quite enjoyed it, and I think if you get some good feedback from students, it encourages you a bit to persist with it. And I think from there, got more and more engaged, and I guess tried to just make it an effort each rotation that I'd at least take on the students that I had, even if there's only a couple, to do a bit of teaching with them and get some feedback on my teaching as well as a part of that.
So let's move on to feedback at this point. What are the keys that you've picked up in terms of creating effective or high quality feedback?
So I think what you've talked about in the presentation earlier is really interesting. It's very difficult to actually enact that idea of not using just words that are saying that was great, this was good, and actually, I guess, putting the quality feedback there and using terms that are quite descriptive. So if I was going to describe Andrew's presentation, rather than saying, look, Andrew, that was great, loved it, saying, look, I think you've targeted well the level of this presentation based on the prior knowledge that a lot of the audience is likely going to have. And I think you've addressed some of the key sort of questions that I would have had at a similar level. And I think that kind of trying to reframe the feedback is very difficult. And the first time we did it as an exercise as a 6 year on the SCAP rotation, and inevitably my feedback was absolutely terrible the first time I did it, or at least that's how it felt.
You realise now.
Yeah, realised it, because it was just very difficult to erase those words from your usual feedback, and it's something I still struggle with, but working on,
Yeah, I'm still challenging myself to get rid of those judgment terms or justify them at the very least. And tell me about, you mentioned before that getting feedback from students has been really valuable. What ways has that informed, and how do you go about eliciting that feedback?
Yeah, so one of the things I've sort of tried to do is I've taken one presentation that I initially started doing with David Lamb back as a fifth year, and I've done the same presentation, I think, probably 15, 20 times over now, to the same group of, sort of ways to a fourth year group of students, and then try to get feedback each time and work out what I can do to change the way in which I present the information, the way in which I targeted it. I've been able to, I guess, get feedback from seniors on the actual information in it and learn more as I go through my career. But I think because I wrote it at the time I was a student, it actually quite well targeted the information I was interested in knowing at that level. I think now, as you go further down the line, it's easy to forget what you actually want to know as a student and what the kind of real key information is. And so I think that was quite a useful process to do that with a single presentation. And now when I try to present to students,
refinement.
I look back at what my notes were at the time as a fourth year and go, look, what things was I writing down, what was I trying to understand at the time.
That's great. Yeah, always considering the audience and what they're looking for. I think it's so important when you're giving a presentation for the first time particularly. And
I think a lot of the lectures you get through med school, you often get a lovely sort of blue background, yellow text or whatever they used to do, presentation that no one's really considered what you've learned already in the course, and unfortunately there's not great communication often to the lecturers, I think, in the courses as to what's already your background knowledge. And so I remember having two lecturers that were asked to give the exact same presentation one after the other and had the identical slides, and the second went, should I bother persisting? And it happens. And so I think doing your background research is one of the most important things to knowing what your students actually want to get out of the session. One of the things I do if I organise the session with students is I get them to take a bit of ownership too, and so ask them to actually physically book the room and find a time that's going to work for them and put it in their hands a little bit to organise the space, because I think that often makes people more engaged if they're wanting a session. There's no point you deciding on a session you think is necessary to be run often it's better if it comes from the students themselves. They can give you an idea of what they want to know.
That's good. In terms of bedside teaching and the like, are you involved in bedside teaching?
Yeah, have been throughout. I think it's always a difficult one to find your time in your day, and I think you really do have to prioritise it. One of the things I've found is that fourth year students on a team often become the mini mental state examiners, and that sort of becomes their role on the team. And I think it's finding a balance between getting your students to help you with jobs, but making sure that if you're going to be doing stuff in the ward, then it's value adding. And so if you're going to ask a student to call for a consult, get them to practice it with you beforehand, listen in on it, and then get them to say at the start, look, my senior's here with me, so you can always jump in and help them if they need. And then afterwards going, look, how do you think you went with it, and using it as a feedback exercise. And I don't think just doing repeat mental state after mental state probably has that thing. That said, here and there's obviously going to be jobs that need to be done by someone on the ward, and if you can help as a student for a little while such that you can free up some time to do some more formal teaching, then I think that's kind of a bit of a fair trade-off. When it comes to
almost what you're lining out there is three kind of levels. There are some things that are purely a learning opportunity, where it's not really adding value to the team's work. The team's really giving to the student. On the other side, there can be things that maybe like just doing your 10th MMSE for the week. You're not learning more from that as a student, but you're contributing to the team and helping them. And I hope that they're paying you in coffee. Pay your students in coffee. Students shouldn't pay for the coffees ever. And then in between there'll be things that are a bit of both. Actually, a lot of times it'll be those things. So the first few times you take bloods or a cannula or do a cannula, having your intern there to supervise directly, or as you get more skilled, some indirect supervision, you're gaining those skills, you're refining those skills, but you're also contributing to the team. And I think identifying the learning and service opportunities between those three, you should do things that contribute to the team. That's just part of being part of the team. That's, you're just not being paid in money. And there are things that the team will do that are just purely goodwill, wanting to help you as a student or helping the trainees. Same thing, but there'll be a lot that is crossing over between the two of them, and I think as much as you can maximise that middle one is a good thing for everybody.
And I found, particularly as you get students closer towards their 6th year or their final year, even things like having them hold the pager for the day is a really great experience for them. And it's something I think you often forget that might be a useful thing, because as an intern you're pretty sick of it by day 2. But I think it's a useful skill as long as you're supporting them and making sure if they are going to go and see a short call for you, that they come back, discuss the case, and then you go and review with them or make sure there's some sort of closing the loop there. Because I think you also have to be careful that you're not putting them into a precarious situation by getting them to do things too senior without that support.
Even like consults, I think is it's a skill that takes a lot of time to develop, and the sooner you can get a bit of a grasp of that and then start the refining process rather than acquiring that skill is great. And so often when I'm doing the consults, especially if I know the person, or even if not, I could sit there, and if you were my student, I'd call, and then I'd say, hey, it's Andrew, the registrar from this team. We're calling for this consult. Is that you? Yeah, it is. Do you mind? I have got my student here, and I can put you on speakerphone. Would you mind if they did the consult? And if there's issues, I'll step in and we can give them some feedback. And most of the time, they're going to say yeah, but most people would prefer that they're asked their permission to do it, rather than having them just cold called by students, particularly if they're not final year students. So I think there is a little bit of etiquette to be aware of. Some people are fine. I'd be happy to be called by a student at any time. But some people have a different approach and they're very busy, and I can understand that they go, I'd rather be asked, and that sometimes I will say yes, and other times I'll say, I'm just really busy, can you just cut to the chase and we could do that another time. And that's okay. That's just part of being in a busy hospital environment.
And I think, the initial question you asked was about bedside teaching, but I think there's a real spectrum between there's the formal bedside shoots that we do, and I think there's specific skills there, and I think working out how to best involve all your students examining the patient whilst also practicing the skill that they need to know for an OSCE. And so even sometimes doing things like a actual 6 or 8 minute examination on them and getting to the full exam rather than just getting everyone to listen to an isolated murmur. I've realised that in 3rd year, the first time I'd ever done a full 8 or 6 minute examination on a patient was in the OSCE, and I never actually practiced doing that on someone with signs. So I'd only just done it on. It's very easy when you're examining each other and you've got no signs. There's nothing to pick up, and so you fly through it in 5 minutes and you've got time to spare. And so I think actually finding what skills specifically that they're wanting to practice and using that in the bedside shoot. But I think I also liked what you said. It's finding that balance between in your presentation of, if they've got a good signs or someone with an interesting patient that's not the specific thing for the week, then that's great. At the same time, just because you've got a good heart murmur, like you could add that into the end of a tute, but I know as a third year I had, I think, probably about 20 tutorials that were listening to heart murmurs, and then one was the actual thing, and so finding a bit of a balance between as well is a tough one to find, but I think it does require you to do a bit of extra work in thinking ahead, and I think that's really where it's easy to get caught off guard. You're thinking all about your patients on the ward, and then all of a sudden it comes around to the time of your tute, and I haven't found a patient, so you really do need to only put an alarm on your phone the morning of and say, look, it's tutorial day today, so you think ahead earlier in the morning and don't get caught out by surprise.
So thanks for your time, Tom, but just to conclude, is there maybe just one or two pieces of advice if you're thinking, if the audience was kind of middle to senior medical students going, I'm really interested in education, and I'm just wanting to know maybe how can I grow my skills, where are opportunities that I should be looking for either now or in the future as I become an intern? What do you think that the Tom back in 5th or 6th year would have liked to hear?
Yeah, I think I had this idea that I had to do a formal type course or needed to go and do a master's or something like that, and I think that's something to encourage and a great way to go. I think initially getting involved with the smaller scale stuff is a great way to get experience and get yourself up to speed, and I think it's really just being someone that does make the effort. A lot of people won't sign up to the bedside tutes or those sort of things, and it comes as a single email and it's very easy to be missed, and so making a real effort to get yourself involved in those things. But I think particularly your best chance to practice teaching is as a 6th year. You're probably the most time poor as an intern and as a 5th year, and in that 1 year of 6th year you've got some time to actually do some of these things.
The window of opportunity.
Yeah, it's that opportunity to really get a chance to actually practice some teaching, and there's a lot of people out there that really would appreciate, particularly the 5th years when they're sitting their big exams. They're often very stressed, and any words of wisdom you can give are always well received, and so I think that's a really good opportunity at that moment to sort of get some of those skills up, and then it flows a lot more naturally. If you've prepped a few presentations that you did as a 6th year, then it's very easy to give them to your interns a couple of years later if you've got the materials there. You don't have to invest that sort of time that you didn't have then. Yeah,
that's good advice. I think that just along that same lines, I often think of the idea that what makes a good educator is someone that has content knowledge and experience, clinical experience ideally, combined with the ability to communicate and educate and teach and facilitate. And those skills, can often be quite independent. There are many people that are, master of their craft as a specialist, but are actually very poor communicators or educators. There are some educators who are very good in terms of the education, but probably need to know their content better. You don't need to master either one to start teaching. As long as you have a decent grasp, and actually the process of teaching, I don't know about you, I found I know my content better, and I'm a better and more knowledgeable clinician because I teach. It makes me go to a deeper level when I'm preparing this stuff. People shy away from teaching areas that they're not confident on. And I think one of the things that I've found has really helped me in my own learning as a junior doctor is to pick the areas that I'm not confident on, and rather than saying, maybe look that up as a learning issue kind of thing, which is often code for I don't know myself, is going, you look it up, I'll look it up as well tonight, we'll come back and have a chat tomorrow. It's a learning opportunity for yourself and it really pushes yourself, and that's where this antibiotics tute started. Is I knew nothing about antibiotics, and so I sat down and tried to do some reading, and then went, okay, maybe this is something I can teach on. So I think it's a good opportunity. Okay, thank you for your time, Tom. No, thank you, Andrew. Good to be here. Continue the conversation off the video. Sounds good. So.